Yeah, please.
Thank you. I'm curious, where are the other companies other than Pfizer? Are you expecting them to come later?
They're all with us. And I was honored to have Albert be the first. He's done a fantastic job with, as you know, with the COVID. He did a fantastic job with a lot of things. He's a leader, and Pfizer is right at the top. You know, it's there. Eli Lilly has been fantastic also, your friend, my friend. And they're all coming in over the next week. We're making deals with all of them.
What was Pfizer got to hide? This is a question that we are all asking after we found out that the CEO of Pfizer, Albert Bourla, pulled out. The interesting thing is, a few weeks ago, the CEO of Moderna, we were criticizing these pharma companies, for being or for lacking transparency. But at least the CEO of Moderna had the courage, I would say, to come and answer questions. Yeah, he did not answer all the questions that we asked, but at least he was present here and was faced with all these questions that all of my colleagues asked. So obviously, when we found out that the CEO of Pfizer decided not to come and answer questions, this is not an inquiry committee. So he was not bound by law to come, and, he was not on record, he was not facing any criminal punishments in case he's lying in front of this committee. But even in that case, he refused to come and answer some concrete and specific questions. Questions that I think all of us and all of you have. And the first question is, what exactly in these contracts? What are they hiding exactly? I mean, in the previous press conferences, I showed you some of the pages, from these contracts. This is how they were disclosed to us, and to the public, and to the press. Obviously, after some of us and some of the brave journalists asked, what are the contracts signed between the European Commission and these pharmaceutical companies? So this is how they disclose the contracts. Over 100 pages. Every contract with Pfizer, with Moderna, tens of pages of those contracts were blacked out. So yesterday when we asked, I was the one asking, and some of my colleagues asked, when are they going to fully release these contracts? The representative of Pfizer, who was sent to replace the CEO of Pfizer, said that they can't fully disclose these contracts because they have some commercial secrets over there, and they have to protect their interests. Now I'm asking you, what about the interests of our people? What about the interests of the Europeans whose money was spent, or wasted, I would say now, to buy these medical products that are not providing what they were marketed for? Because what we found out yesterday, when one of my colleagues asked if they tested, in this case Pfizer, if Pfizer tested, if their medical product is stopping the spread of the virus, we were shocked to find out yesterday that they haven't tested their vaccine to see if it's stopping the spread of the virus. So we are now more than a year after the green certificate, the digital green certificate was imposed in the European Union, and people were forced to be vaccinated with a medical product in order to exercise their basic fundamental rights, and they were told, and we were told. We were voted against the green certificate, but many of our colleagues voted in favor of it because they believe what these companies have said, that if you get vaccinated, you will not be infected and you will not spread the virus. They even ran a campaign and said, get vaccinated in order to keep your grandmother and your parents healthy. And we find out now, after more than a year, that when they requested the special marketing authorization, they haven't tested the vaccine to see if it's stopping the spread of the virus. So I'm asking again, and we are asking again, what are they going to hide? What do they hide exactly? Why aren't they transparent with their medical product? We heard yesterday, I was shocked. Because Pfizer used this opportunity just to do a PR campaign and even lecture us. Why are we asking this and not asking that? Who are they to question us? What kind of questions do we ask? We are elected by the people, for the people, not they. And they are supposed to answer all these questions, which they have not. There's another issue right now raised all across Europe. The excess mortality rate in the month of July 2020. According to Eurostat, in the month of July, the excess mortality rate all across European Union went up 16% more than the average of 2016 and 2019. Now, if you look on the map here, this is released by the Eurostat. It's not from us. If you look on this map, you will see that the countries with the highest vaccination rate have right now the highest mortality rate. So obviously we asked, is there a connection between being vaccinated and having a higher mortality rate? Everybody's avoiding answering this, I would say, logical question. There's another issue. A year ago, I requested Emma to submit some details and data to me because I wanted to have an informed decision, I would say, when I voted in favor or against the green certificate. And one of the questions that I asked Emma is to send me all the trials, the tests, the clinical trials that all these medical companies had done, either in animals or in humans, before they requested the marketing authorization. So in the case of Pfizer, here's something interesting. Commodity. When they submitted the information and the clinical trials to Pfizer, here's all the tests that they submitted along with the request. They submitted a clinical trial that started in January 14th, 2020. I asked yesterday the representative of Pfizer and she declined to answer. How is it possible that we, the world, found out in December of 2019 that there is a COVID, or coronavirus as it's called, in China, December of 2019. On January the 11th, the Chinese government released the DNA data, or a segment of it, to the public, and 3 days later, Pfizer already started the tests for this vaccine. How is that possible? She did not answer. In the case of Moderna, and I've asked the CEO of Moderna 2-3 weeks ago when he was here, they submitted trials since 2017. So I'm restating the question, how is it possible that when we found out in the fall of December, winter of 2019 about this virus, they submitted tests of their vaccines years before we found out about the virus? And I'm still asking that question now. How is that possible? So these are the legit questions that we all asked, and that people are asking us. And unfortunately, they are declining to answer. So these were the main topics, I would say, that we tried to clarify yesterday. And unfortunately, the Pfizer representative, as Moderna representative, declined to answer. We will keep pushing to clarify these facts, and nevertheless, to make sure that the European Commission is going to fully release the content of these contracts. Thank you.
Walk us through this. The FDA approved Pfizer's vaccine in light speed. Why would they want 75 years before they make all this information public?
So, it seems comical that it's this long, but the fact is that data is submitted in digital form. And it means, as an expert in deep learning and in machine learning, that's easily accessible data to be able to look at it, massage it, and get various statistics out of it. The trouble with courts here in the United States is they want paper documents. Do you know how many pages? 329,000 pages worth of data. So there's a disconnect here in that the courts always want this paper data, and it's a way of really lining the pockets of the lawyers that are involved. If they went back and said, we'll give you the digital data, fine. But the other sort of interesting part of this, Manila, is that you can't just turn over documentation or data. You have to look at it to make certain that there are no trade secrets there or other information you don't want out. So bottom line, it's a very reasonable request, but of course it's really sort of blown up by the U.S. judicial system that seems to favor the lawyers over the clients and plaintiffs.
That is to put it lightly, Dr. Bob. Ben, to put this into perspective, even top secret military missions, UFO files, and all that stuff, those are kept under wraps for shorter periods than this. Don't these optics come off as like obfuscation and just add to the skepticism about these vaccines?
Right. Well, the timeline, let's face it, it's ludicrous, right? And there are a lot of reasons for it. Look, the FDA is saying essentially, look, in order to turn this over, we only have 10 employees who do this. 2 of them are brand new. There's no way we can do more than 500 pages a month, which, quite candidly, even if you're being kind, I think seems like a pretty slow pace. 500 pages a month is all they can do, but they say they have other FOIA requests they have to get to. Here's the problem, though, is when you have a company like Pfizer that receives billions of dollars in taxpayer funds, when it is allowed kind of these green lights to move at a breakneck pace, but the fact that vaccine makers have, shield liability from lawsuits, when there's all this in place, and then, the FDA turns around and says, we need 75 years, longer than the lifetime of almost every single person who's on the earth right now, including infants. People look at that and say, what? It just makes no sense at all. I mean, it would be better to sit down and say, listen, we need to talk about a reasonable way to do this. But when you throw out numbers like 55 years and 75 years, I think Dr. Bob and I are probably going to disagree on a lot of things. But one thing I think we can absolutely agree on is that there is a major trust deficit in this country right now when it comes to science and medicine, a huge deficit. Statements like this from the FDA do not help in that cause at all.
Yeah, I would think that this would be a more urgent matter, seeing as millions of people are being subjugated and mandated to take this shot or risk losing their jobs, their entire livelihoods. I mean, the FDA, saying that they can only process like a few hundred pages a month is too big an undertaking, just blows my mind.
Bourla, can I ask you, when did you know that the vaccines didn't stop transmission? How long did you know that without saying it publicly?
Thank you very much.
I'm sorry. Answer that question. I mean, we now know that the vaccines didn't stop transmission, but why did you keep it secret? You said it was 100% effective, then 90%, then 80%, then 70%. But we now know that the vaccines do not stop transmission. Why did you keep that secret?
Have a nice day.
I won't have a nice day until I know the answer. Why did you keep it a secret that your vaccine did not stop transmission?
Is it time to apologise to the world, sir? To give refunds back to the countries that poured all their money into your vaccine that doesn't work, your ineffective vaccine?
Yeah, you have a little bit around.
Are you not ashamed of what you've done in the last couple of years?
Do you have any apologies to the public, sir?
Are you proud of it? You've made millions on the backs of people's entire livelihoods. How does that feel to walk the streets as a millionaire on the backs of the regular person at home in Australia, in England, in Canada?
What do you think about on your yacht, sir? What do you think about on your private jet? Are you worried about product liability? Are you worried about myocarditis?
What about the sudden deaths?
What do you have to say about young men dropping dead of heart attacks every day? Why won't you answer these basic questions? No apologies, sir.
Do you think you should be charged criminally for some of the criminal behaviour you've obviously been a part of?
How much money have you personally made off the vaccine?
How many boosters do you think it'll take for you to be happy enough with your earnings? Nothing?
Who did you meet with here in secret? Will you disclose who you met with? Who did you pay commissions to? In the past, Pfizer has paid $2.3 billion in fines for deceptive marketing. Have you engaged in that same conduct again? Are you under investigation like you were before for your deceptive marketing, sir?
If any other product in the world doesn't work, as promised, you get a refund. Should you not refund to countries that laid out billions for your ineffective vaccine?
Are you used to only sympathetic media, so you don't know how to answer any questions?
Is that it? Shame on you, sir.
Shame on you.
Pfizer's internal documents identify that the vaccines have vaccine failure and failure of efficacy, and they identify that the third most common side effect of the Pfizer vaccine is COVID. The second headline, which is stunning, is that within a month or two, Pfizer was getting so many reports of adverse events, meaning bad things happening to people who had been injected, that they understood that they needed to hire 2,400 full-time staffers in order simply to process the paperwork of the adverse events that they were receiving reports of, as well as to prepare for the flood of adverse events that they knew they would get in the near future. Pfizer knew in May of 2021 that the vaccines had caused heart damage in 35 minors within a week after the injection. And Pfizer knew, right? You've got to understand that all of these documents say FDA confidential at the bottom of them, right? Pfizer and the FDA shared these documents. And the FDA knew that 35 minors sustained heart damage. But the government of the United States, and I'm embarrassed to say I voted for these people, didn't tell parents until August of 2021 that there was an elevated risk of heart damage in healthy young adults. 4 months later, and in those 4 months, what did the young adults of America receive? A constant battering with propaganda on social media, on television, in news outlets, bought up by money in the CARES Act, as well as from the Bill and Melinda Gates Foundation, with influencers showing off their injection site, saying, we can do this together, we can be strong, do it for grandma. All of this aimed at young adults. They did not tell the young adults, the healthy young adults of the United States, your generation, that this was elevating a risk of heart damage, till 4 months later. You may recall that the CDC said that the materials of the injection stay in the injection site. And the materials are lipid nanoparticles, they are mRNA, and the lipid nanoparticles are an industrial fat, which is covered in polyethylene glycol, which is a petroleum byproduct, right? And spike protein. Well, the CDC said it stays in the injection site. And then it says, and I remember asking doctors, relatives who are doctors and were funded by NIH grants, where does the spike protein go? And they were like, when you're a journalist, you've got an ear for nonsense. They were like, well, your body metabolizes it, or, well, you'll digest it and excrete it. And it's like they had no evidence to give me, to show me the basis for their response. But in fact, that's not what happens to these materials. And Pfizer knew that. These materials biodistribute, this is Pfizer's language, throughout your body in 48 hours. And where do they settle? Lipid nanoparticles are designed to cross every membrane in the human body. They've known this for 10 years. So where do these ingredients go? They go to the brain. Some of you have noticed changes in the personalities of loved ones who have taken these injections. They biodistribute to the liver, the adrenals, the spleen, and if you're a woman, they accumulate in your ovaries. Now, these are industrial fats coated with polyethylene glycol in your ovaries, okay? And what's really scary, Dr. Robert Chandler, who's a respected pathologist who's treated the Lakers and the Angels, he wrote this report, and he shows that the chart shows the graph going down as it leaves the injection site, but going up as it accumulates in these various organs over time. And what's incredibly scary if you're a woman is that there's no mechanism that we've found by which the body gets rid of the lipid nanoparticles in the ovaries. So your first injection, some go into your ovaries. Your second injection, more go into your ovaries. Your booster, more go into your ovaries. There's no mechanism with which the body can release this material that we've seen.
Clearly, the situation has been deteriorated because of the Omicron. We had a very quick ramp up. It is a disease that manifests a little bit less in terms of mildness. I mean, it's more mild, but because of the high infectious rates, still the hospitals in absolute numbers are going much higher in terms of severe disease, ICUs, occupation, et cetera, et cetera. So, and we know that the 2 doses of the vaccine offer very limited protection, if any. The 3 doses with a booster, they offer reasonable protection against hospitalization and deaths. Against deaths, I think very good. And less protection against infection.